Good evening, everyone. My name is Sahelia James Bernard. My research project is going to be going further in depth from what we've learned during the course reading the North House text about psychodynamic approaches of leadership and organizational learning. A quick overview of what we're going to learn today would be we're going to redefine psychodynamic approach. We're going to learn about the purpose of organizational learning. We're going to break down the clinical paradigm. We're going to learn how to integrate the psychodynamic approach in the workplace and organizational learning in general. We're going to learn how the clinical paradigm relates to organizational learning. Further on into the presentation, I would have shown an example of it and explain it as we go along. We're going to learn more about emotional intelligence and how emotions in general corresponds with the psychodynamic approach in a work setting that may affect not only the leaders but can also affect employees with their actions and reactions to certain situations. We're also going to cover the effects of psychodynamics and psychopathology in organizational learning. So to start off, we're going to go over a few definitions like I've said before. So according to the Business Dictionary, we're going to look at the definition of psychodynamics. It can be described in three different ways. As an adjective, the psychology of mental or emotional forces or processes developing especially in early childhood and their effect on behavior and mental states. Psychodynamic can also be described as an explanation or interpretation as of the behavior and mental states in terms of mental or emotional forces or processes. Psychodynamics can also be described as motivational forces acting especially on the unconscious level. So something that drives someone to act in a certain way without them even being aware of it. We're also going to learn a bit about psychopathology and psychotherapy. Psychopathology is a term which refers to either the study of mental illness or mental distress, or the manifestation of behaviors and experiences which may be indicative of mental illness or psychological impairment. Psychotherapy is a range of techniques which use only dialogue and communication and one-on-one basis. It's usually with one person communicating with another, expressing their feelings. And they're designed to improve the mental health of a client or a patient, or in our case, an individual, a peer, an employee, or a leader. So such as family or in a work group. So that's in our case, we'll be looking at it in a more objective work group setting. So what is the psychodynamic approach? The psychodynamic approach is focused on human behavior and studies leadership and development. Which of all elements is the hardest to define and understand? Oftentimes, emotions and complex realities are not mentioned or brought to life in a work setting because many feel uncomfortable discussing their past. However, through understanding one's past, one can have better control of their future. By having control, one can improve not only their actions in the workplace, but also their personal goals and attitudes towards employees, which will also be their followers if they were the leader, or fellow leaders alike. Their actions can also help them out internally so they can understand why they act in the way that they do. Which leads us to our next bullet point. It explains the 5 W's and the H as to why people behave in organizational settings the way that they do. The 5 W's would be who, what, when, where, why, and then of course the H is the how. And then who in an organization is usually the individual, either an employee or a leader. The what are the causes to make the employee or leader to react to a certain situation in a different way than one might consider normal or justified. When is the timing in which someone reacts to a situation or statement that maybe they didn't like. So this timing can be instantaneous, or it can be calculated where someone has a reaction to what was said or what was done. However, instead of reacting instantaneously, they suppress their emotion and later on react. Where for this purpose it's going to be situational, but because we're talking about organizational learning, it will be within the organization itself where psychodynamic emotion will be explored. The why explains why people behave in the way that they do, so it's self-explanatory. Why is just exactly that. Why? The psychodynamic approach also explores that infamous H, how one came to be who one is based on their past experience or their childhood. Further on, we're going to talk about findings from past researchers that did some studies with one's childhood to get the upbringing, to uproot the emotion that one feels and understand why it is these actions have those reactions. So by now you must be asking yourself, how does this approach, how does a psychodynamic approach differ from other approaches in an organizational setting? Well, people are complicated and individually unique in their own way. Rational perspective, which is usually the rational lens, are logical choices and behaviors depicted of a leader that most people understand without question or extended definitions. However, irrational lenses, where people do not understand someone else's action or behavior, also comes into question. So we're going to explore these two lenses. Rational lenses, for example, would be pragmatic, healthy, and positive. However, the majority of the leadership approaches we have studied throughout the course avoid irrational perspective or lenses because it is unknown and many would rather not intertwine irrational, also known as emotional, and psychological rationale into business decisions, which is what we were going to explore later on, how emotional decision making sometimes clouds one's judgment, so they rather not have irrational lenses when in a work setting. However, we need to take the irrational as a reality. This approach brushes up on reality and the ugly that it is that no one likes to discuss. There's no sugarcoating with irrational lenses. Irrational lenses are illogical, non-pragmatic, and unhealthy. These terms are used in psychology to describe behaviors. Rational lenses would be considered constructive criticisms, realistic thoughts, and functional ideas, whereas irrational lenses would be considered destructive behavior and dysfunctional ideas. Even though they're also realistic, they would be considered negative criticisms. According to David, Lynn, and Ellis from Oxford University, a few Oxford University authors who wrote Rational and Irrational Beliefs, Research Theory and Clinical Practice in 2010, we learn about the framework of one's functionality through the clinical paradigm. So the clinical paradigm is an outline through the psychodynamic lens that studies the behavior of leaders in organizations. This is depicted using 4 basic premises. So the first one is that each human action has a rational explanation, even for irrational actions that may seem unjust through the eyes of some. There is an explanation for someone's actions. The explanation may need further analysis of the leader's wants, needs, fantasies, or desires. However, an explanation lies beneath the initial reaction nonetheless. This is stemming from Sigmund Freud's belief that every action has an explanation. Our thoughts, fears, and motives are all mental, but they're subconscious. One cannot control their floating thoughts. One cannot control if they're scared, excited, or, feeling vulnerable. These are natural reactions and expressions that one has, but they're all mental, but they're not something that someone can force to express. They just come naturally. Sometimes we are unaware of our own actions. One simply cannot be 100% spot on each time, every time. Even the most pristine and prim and proper person makes mistakes. Whether or not they're aware of said mistakes is irrelevant, but more than likely they do happen. Everyone regulates and expresses emotions differently, like how I went over earlier that some people have instantaneous reactions, where some suppress emotions and pretend as if they do not have emotions. However, later on, they release that feeling in another way. These emotions can be expressed either positively or negatively and may follow an individual when he or she is ready to make another decision similar to it in the future. However, according to American psychologists Plutchik and Tompkins, who created a multi-dimensional model of emotions based on Charles Darwin's evolutionary theory, it is never sealed. One's emotion is never sealed into their cognitive reaction. It can change as the years go by. People can indeed control their expressions as time goes on. Human development is an and intra-personal process. Regardless of how one may want to erase or forget about their past and their past experiences, it is those experiences that help to form and mold who one is today. What was taught to us by our parents, teachers, or guardians has great influence on how we currently act. So here we have an example of the clinical paradigm that I've been talking about. This is Plutchik's model. The clinical paradigm reveals subconscious and hidden forces about oneself that they may or may not have known about before, and it explains their underlying behavior. As stated prior, one's emotion can evolve over time. The vertical dimensions on this model depicts intensity. For example, let's take a look at the red petal. Let's take a look at the red petal. Rage is in the center of the paradigm. It is the most intense one may feel in reaction to something over time. That emotion, however, can simmer down to anger and then annoyance, where something once boiled one's blood now it upsets them, and then that once raging anger is now a slight irritation. The same goes in reverse effect of the three-dimensional petals that we're seeing in Plutchik's model. If we take a look at the tip of the lime green petal, upon meeting someone, we'll use an example in a work setting. Upon meeting a new employee, one gets to know them better and they accept them into the circle, into the workplace, and getting to know them on a more personal level, a trust and a bond is then formed. Once you know someone on personal levels, let's say this person is your supervisor or leader, you're seeing them on a different light, and that trust that you have for your leader is then turned into an admiration. And as a follower, your admiration makes you want to be just like that leader. You'd want to follow suit. You'd want to follow the footsteps of said leader. What is organizational learning? Well, according to the Business Dictionary, organizational learning is an organizational-wide continuous process that enhances its collective ability to accept, make sense of, and respond to internal and external change. Organizational learning is more than the sum of the information held by employees. It requires systematic integration and collective interpretation of new knowledge that leads to collective action and involves risk-taking as experimentation. We'll look at that again. It requires systematic integration and collective interpretation. Remember those two terms. We're going to go over it later on in the presentation in depth. Applying the psychodynamic approach in organizational learning is not usually done in the 21st century. The majority of this research involving psychodynamic approach was conducted prior to the 21st century, but were mainly based on people with mental illness, such as bipolar people or people that were narcissistic or with multiple personalities and schizophrenia. They weren't ideally just for workplace studies. However, based on the research that was done, it was placed in the workplace to get a deeper understanding of just the human mind. Much of the research stemmed from Sigmund Freud's belief that the neurotic symptoms or dysfunctional behavior were created from a person's internal drive. Oftentimes, it's the unconscious action that takes place, which Freud believes that each action has an underlying reason to it. So, Sigmund Freud's study of human behavior's theories come from the structure of this approach. Mental illness was then expanded to overall thinking and motivations and inner drives. Every action has a reaction and an explanation. Other scholars picked up from where Freud left off and applied his theory to the workplace and explored the inner worlds of leaders. So researchers applied the study of the psychodynamics to organization to help illuminate the irrational processes that are between a leader and a follower. Leaders are said to have inner childhood fears, needs, hopes, and fantasies that are very influential in their day-to-day decision making and leadership motivation or a lack thereof. However, these inner childhood fears, needs, hopes, and fantasies are also within employees that take instructions from leaders that may or may not have the same experiences. So by exploring these dynamics, we have a better understanding as to why certain relationships in between leaders and employees do and do not work well. In 1942, the Menninger Clinic was founded. The purpose of the clinic was to promote psychodynamic approaches into the working society. In the mid-50s, a national survey of mental health problems in numerous industries were conducted. In response to the survey, Menninger hosted seminars in many places to explain why leaders and managers act the way that they do and get certain results from followers. He also suggested ways to improve management, ways to smoothen and level anxiety in the workplace and improve employee productivity. He argued that if management did not pay attention to the conscious and subconscious needs of their employees, organizational performance would be drastically affected. He created a new clinical contribution to the diagnosis of systemic organizational problems that were once overlooked. We're going to continue looking into psychodynamic approach and organizational learning in the earlier years. John Bowlby was a psychoanalyst like Sigmund Freud that believed that mental health and behavioral problems could be attributed to early childhood. He attached social and behavioristic approach to personality using Freud's psychodynamic theories. The Bowlby trilogy shows attachment and loss using theoretical and empirical strategies. In early childhood, we show how attachment develops. The primary bond in early childhood is with a child and his or her mother. This starts from within the womb and develops further once the child is born. Much like in the workplace when an employee looks towards the leader for guidance. If a child is discomforted, he looks towards his mother for comforting, a hug, food, or even a smile. A new employee may feel discomfort on their first day or their first week on a job and would look towards their leader or supervisor for words of encouragement or wisdom, or how to handle another employee or something similar to that in that context. The second part of the Bowlby trilogy shows how attachment is maintained. Within the first 2 years of development, a child stays with his or her guardians and repeats and acts like a sponge in accordance to what is being taught to him or her. If at any moment in those 2 years that bond is broken or shortchanged for any reason, maternal deprivation and loss can result in long-term cognitive and social and even emotional difficulties for that infant that can follow them for the rest of their life. This is similar to the workplace where a new employee who once followed and admired a supervisor or manager that now neglects or completely just shunned them out and stop paying attention to that employee's efforts altogether. The third part of the trilogy shows what function it fulfills, such as delinquency and the short and long-term separation consequences. Delinquency where an employee shows up to work tardy or um, is acting less productive at work because he or she has no desire to be at work anymore because they're not being acknowledged, or the employee can still try to oversell and overachieve in his or her efforts to try and get recognition once more. So it can go either way, where the employee can get self-destructive or the employee can try and overcompensate. The self-destructive area can make an employee become increasingly aggressive, not only towards the supervisor that's now neglecting him or her, but the employee can be aggressive towards perhaps the other new employee that's now getting the shine that that employee once got. The playing with one's emotion intentionally or unintentionally is not something that one thinks about in the workplace. However, it does take place. If one no longer feels monitored, just like a child is lashing out, a method would be not to show up to work or to arrive tardy daily. An invisible barrier may also develop where a child feels the emotion of despair of being abandoned or ignored by his or her guardian, but the child would not show it. I'm not entirely saying the child would be a sociopath or a psychopath, but suppressing one's emotion at a younger age, however, can indeed dramatically affect their adult life. The same goes for an employee that may continue to work effortlessly, like I've said before, but just not getting the acknowledgement. They can act hostile and later on express that to said employee, to said leader, I mean. Personalities shouldn't, but they do have an effect on the functionality in a workplace. Licensing and Living focus on systematic techniques and empirical evidence such as long and short-term psychodynamic psychotherapy. This affects one's level of functioning in general and the outcome that stems from the employee. Personality development proceeds in a dialect and the synergy interaction between the development of capacities for interpersonal relatedness and the development of self-definition, finding oneself and accepting who they are. Organizations are prone to ego defenses. These defenses are dysfunctional when they militate against necessary organizational change. Maladaptive identity defense mechanisms can be mitigated through processes of organizational learning in the form of critical self-reflexivity and an identity-focused dialogue which promotes attitudes of wisdom. Brown and Starsky wrote about such ego defenses like cognition, denial, fantasy, and adaptation. Blatt and Levy also stated that the diagnosis of psychopathology is simple. It is better to understand the dynamics and circumstances that result in people being in emotional distress and how to best treat them. The how-to is still subject to a definite conclusion. There are many techniques and ways to get someone to neutralize themselves. However, it is on a situational basis. The Diagnostic and Statistical Manual of Mental Disorders was developed by the American Psychiatric Association, DSM. So individual versus organizational learning. Individual learning is each individual person and a workplace that collectively contributes to organizational learning. Daniel Kim argues that everyone learns in an organization, even if they're not intentionally trying to do so. A working environment is a progressive learning environment as well. Individually, employees advance organizational learning. In any organization, there are different levels of employees. Therefore, there are different levels of learning. It's a chain link effect, the evolution of learning structure. An older or veteran employee teaches a junior associate. The junior associate then teaches an entry-level employee. These individual learning processes are embedded in the organizational structure and memory of the organization. The link between organizational psychology and theory are now put into place, and they create organizational goals, visions, and values. Here we have an example of the chain link that I just described. So we'll have the someone with concrete experience and information that is widespread within the company or within the initial leader. That process is then integrated with new and local information and observation and reflects into the organizational context. Things are then generalized into abstract concepts and collectively interpreted. Then, what was interpreted is then applied into the new concepts and situations, and responsibility is taken, leading the cycle right back into new learned experience that one can take with them on the cycle once again and apply it either to a new experience once more and take what they've learned. As one would expect, emotions do have a large part to deal with organizational learning. Emotional intelligence also plays a role in getting people to understand why leaders act in the way that they do. Stress, agility, and excitement, nervousness, all of these emotions do run high. Individual learning. The study of emotion in organization is seen as an important part of the development of organizational learning. Awareness of the impact of emotion on organizational learning can be developed through an investigation of two areas: individual and systematic learning. First, organizational learning is more than a product of organizational responses to individual learning. Emotion contributes to a broader understanding of systematic learning. Second, emotion is important to strategic aspects of organizational learning. There is a link between the emotional and the political within organizations. Organizational learning is visible in the organizational dynamics created by the interaction between politics and power relations and emotion within an organization. One cannot check their emotions at the door with psychodynamics. Those emotions are embedded in them long ago, in their childhood. Here we'll continue to look at individual and organizational learning. A large collection of diverse individuals is with organizational group learning. It's more complex in individual learning, but it's a big part of human learning. Motivation and reward. Those two complexities coincide with getting responses from one's employees or followers. By learning through its individual employees, an organization is affected directly and indirectly. So I found one of these great quotes. A man viewed as a behaving system is quite simple. The apparent complexity of his behavior over time is largely a reflection of the complexity of the environment in which he finds himself. Basically, an individual and an organization learn from his or herself or his or her employees. One can change his or her responses based on these learning rules. They don't have to stay the same. To be able to make a change and make an effort in one's organization and in one's self and their behavior, they must first get to know their identity. They should be able to answer these two questions. Who am I? And also, who are we, as in, who are we as an organization? In order to run with other entities in the long run, one must be able to answer those questions. An organization must be able to also answer that question. This is why we try to get to the root of these bases through psychodynamics. What we stand for, what is our purpose, must be instilled in the members of an organization so that the flow of things stay on track and outside factors such as personal experiences and distractions do not deter the ultimate goal or value set. So here are a few positives that I took away from the psychodynamic approach in organizational learning. This approach can get one to dig deep and get answers to behaviors that they once never understood, and they just thought it was, oh, it's just the way that I am, or it's just how I've always handled things, how I've always done things. But they truly understand why it is that it's done in that way. Organizations can, understand why their business strategies did or did not work, or why the owner or leader could never mesh well with other employees. It can save the organizations. It can save jobs. It can save the jobs of leaders and employees that act irrationally to situations. That irrational behavior may be justified in the mind of the employee or leader, but to others, they see something else. The employee or the leader is now able to see the error of their ways through the eyes of others and address it accordingly. There are a few negative things that come out of the psychodynamic approach in organizational learning, such as there's not enough research done on this type of approach for the 21st century. The majority of it was conducted in the earlier and late 20th century, and a little bit with Sigmund Freud and the other researchers that later on stemmed into the psychodynamic approach overall in a working setting. There are multiple variables, so therefore there are multiple outcomes. These variables include numerous working industries and numerous working tactics and strategies and diverse backgrounds of employees and diverse backgrounds of leaders that make things a bit more complex. If a leader is not in tune with his or her own psychodynamic behavior, he is unable to help others. It's those diverse backgrounds that can make things harder on a leader to teach groups and organizations with one base or with one set structure. The teaching technique may need to be tailored or accommodated to fit different individuals. The research done before was more opinionated than scientific. So those are a few changes that I see can happen with this approach in the future. So in conclusion, I would like to see additional research done to further prove the usefulness of psychodynamic approaches in organizational learning. The majority of the work done before was mainly focused on mental illness. However, since we're using it in a workplace setting, I would rather the research be done in workplace settings with, average to normal, not patients, but work individuals. And they can also have consultants to go back and forth and analyze the behaviors of said employees and leaders. The study of psychodynamic approaches is so broad that research is still not complete. It's not rational or it's not conclusive. Psychoanalysis and organizational studies, psychoanalytic theory, and techniques have become increasingly sophisticated as time goes on, and so did technology, and new mental illness and emotions are developed since the 20th century. So I believe using some national surveys and studies like how Millinger and Tompkins did may help broaden the research for this kind of study. There can be central focus groups for the research, such as specific industries that are being conducted for these surveys, and specific leaders that have one particular background or have one particular experience that can possibly, in the past, that can possibly influence the type of leader that they are now. Once that self-knowledge is obtained, a leader can flourish not only personally, but he or she can also be a better influence of his or her peers and employees. Employees that are greatly influenced and motivated tend to perform better. Getting into the psychiatric mind of someone, of who one is, can indeed be liberating, like the ones completed by Mellinger. It could just be more of an expanded complexity. Conscious and subconscious reactions can be separated to be focused on as well, where one is well aware of their reaction, and where one is not aware of their reaction. Those two can be tracked down separately in terms of getting conclusive results of psychodynamic behavior in organizational learning. Individual psychodynamic analysis is constructive, but it can be difficult to apply to a team. Having consultations, like I said before, would be a great addition to this approach, to be both structural and developmental in helping others control their own inner demons. So that's what I have for you guys today. If you have any questions, please upload them. I'll be looking forward to responding to your videos soon. Have a great evening. Thank you. Please note that all references are underneath each slide to coincide with what I've been discussing throughout the whole presentation.